So let's begin with our topic, stress management. I'm happy so many of you have come in the morning on a Sunday. So what is stress? Let me give you some basic idea about it. Maybe many of you already know about it. It's nice to have some quick overview of what is stress and generally what are the trends in stress management before I would talk a little bit more about my own personal views about it and things like that. So stress is a condition or a feeling experienced by anyone, especially when the demands on him exceeds his own personal resources or the social resources. So you are in a situation where you feel your own personal resources are falling short or whatever social resources are there and the demand becomes too much. That is the time where we experience stress. So in short, what we feel when we think we have lost control over events. So I think we all go through this. There is nothing which we are not aware of. So it's a normal reaction to the demands of life. Now, how does this happen? Our brain is hardwired with an alarm system for our protection. So we all have this protective device within us, and whenever our mind perceives any threat of any type, immediately it signals our body to release certain hormones, and they respond to the stress. And this is what we call as the fight or the flight response. So whenever we perceive threat, immediately our body reacts by releasing certain hormones. Now this is very essential. It is for our survival because it helps us cope with or survive in certain adverse situations. Just like fever. Fever is not a problem when you have fever. It is your body's way of coping with what you call as an attack from something which is external, like some virus or a bacteria. You also increase your sweating whenever you are in stress. But that is a cooling mechanism, because when you are in stress, your body gets heated up and you need to cool it. Also, the blood is diverted from the skin into the inner organs so that in case there is any injury, the blood loss is less. Also, when you are in this, hormones help you to concentrate, focus on what you have to do. And you don't think of anything else. That time you are only single-pointedly thinking of the thing which you have to do. So this is the whole way your body gears up to face an event which it perceives as threat. But this does not happen only in life-threatening situations. It's not only when there is danger to our life that our body releases hormones. Anything unexpected, anything that frustrates our goal also will release this. And your body reacts as if there is a big problem. If there is a small threat, the response is small. And most of the time we don't even notice it. We don't even know that we are releasing this hormone. And what are the negative consequences of this? Everything is not always positive. There are many of us we know, without reason we don't know why we are very excitable, why we are very anxious, jumpy, irritable. Because of this hormone, we cannot function effectively with other people. Also, because of this whole body trembling and heart pounding, you cannot do very precise work. So when it becomes too much, instead of helping you cope with that situation, it deters. You cannot function. What we need generally is to be calm, rational, controlled, and also socially sensitive how we are relating to other people. But this does not happen because we are very hyper, we are agitated. So we need this fight and flight response, but we also need to keep it in check. Now this is tricky. How do we do this? Because if you don't do it, finally it will affect your health, because all the time you are on a emergency mode. And then we all have I don't know whether you all come encounter, but I see many patients burnt out, tired, fagged, cannot do anything. Morning when they get up, they are not refreshed. They don't know how to deal with life. Everything tires them. This is what we call as burnt out. So generally, once the threat is gone, our body then comes back to a normal state. But with modern lifestyle, it's sort of this alarm system is never shut off. The way we are living in the modern life, it's all the time on, switched on. And the body remains on high alert. Unfortunately, we don't even know that it is happening. We are not aware into ourselves. So there is this concept of inverted U model. It is like this. If you chart performance and pressure, we all need pressures. Let's say there's a child who is in school. He has no pressures, he is not going to study at all. So certain amount of anxiety should be there that after 1 month I have an exam, I better open my books. But there are some who want to come first in the class and they take too much of pressure and then they blank out and they can't function. So we need optimum pressure. Too little or too much of pressure doesn't work well with us. So finally, as we are talking, that too much of this stress will affect your performance. So there are certain things what affects your performance. One is the skill level. We all know that if you are skillful, then you can perform better. It's like I know this job, so I have no tension. If I am giving lectures every day, almost every day, then coming on the stage may not be a big problem for me, right? But somebody doing it for the first time, maybe he doesn't know and he might be a little anxious. Second is personality. This is not 100% true, but very often people who are extroverted, probably extroverted are also a little more confident about themselves. They can speak up, they can talk. They cope with such situations much better and they perform much better than people who are introverted. But what is very important is the trait anxiety. This is something we have to work with. Skill we can make. Introvert, extrovert, probably we can't help ourselves. But trait anxiety. What is trait anxiety? How much we have a self-talk inside us. A lot of time we have self-talk. Can I do it? Can I not do it? What will people think? Is it possible? Not possible? Am I crazy? So much of self-thought goes on before you do anything. A simple task, but your mind has run millions of questions in your mind. This is the self-talk. Now this is very important. Trait anxiety. So this is your trait within. People who criticize themselves, question themselves, then they cannot function to the optimum level. So this is something which we really need to address and what we can do about this. And last is task complexity. This we all know. If the task is simple, it is easy. If the task is complex, I think most of us would have a little bit more stress because how we'll cope with it or not. So what are the signs of stress? Now how do we know that I am in stress? As I said, most of the time we don't even know that my alarm system is on. So very often patients who come to us, they come with frequent headaches. Now why should a headache come? But they say, every few days I get this big headache and I don't know what to do. Another thing about trait anxiety, many of them who have trait anxiety or very anxious personalities, they have sweaty palms. Their hands are cold, they are very wet. Sometimes you just shake hands with somebody and then you know, hey, he's a little anxious man because their hands are very sweaty. Other is stomach upsets, heartburns, you have stomach pains, nausea, and lot of minor psychiatric disorders also. Of course, you can have panic attack, big panic attack. I think if you have a panic attack, you will straight away go to a doctor and then he will diagnose. But very often we have either you sleep too much because you are tired, or you don't get sleep, or you cannot concentrate. When you are too stressed, you are trying to concentrate but you cannot. So when the cause is known, it is called phobia. When it occurs without any apparent cause and in a very big form, then it is called panic attack. And it's very common, extremely common. And more people are getting this sort of problems. So there can be many minor, you don't even know, but like somebody starts withdrawing from society, becomes isolated, or all the time tired, or you become very irritable, or for no apparent reason you start losing weight. And the feeling is very often, most of them would say, I'm feeling overwhelmed. Now it's becoming too much for me. Now I can't take this anymore. Problem is that, we are very often, not very often, we are always almost connected with the outer. We don't connect with ourselves within. This is the problem. And then what happens is your immune system, immunity is what? Defense. Your body's defense against attacks. And you're all the time thinking attacked. So your body is going on reacting and your immune system goes for a toss. You start falling ill. And whatever might be your pre-existing illness, that also can become more. Then there is anticipatory. Anticipatory is of something going to happen in future. Some performance, I have to present some thing in front of the meeting in a group, and then I have to prepare for it, and then there is an anticipation. But very often anticipation is, I don't know what I am worried about, but then all the time you are anxious. It can be very vague, it can be very undefined, you don't know what it is. So these are very common ones. Situational stress. It's a scary situation. Something where you don't have a control. Scary means not scary, but it is out of your control. Things are not happening, you don't know what to do. Situational stress. Ghar mein shaadi hai. Hundreds of people are there and you don't have people to manage. No, it's a common situational stress. And very often is the encounter stress. This encounter stress is very important. All of us to some extent, what is our equation with people? Nobody has very good equation. Most of us have some issues somewhere. So it revolves around people. How to deal with people, how to deal with certain, like my boss, how will I deal with him? Or my colleagues, my co-workers, how do I deal with them? Or sometimes there's a contact overload, too many people all the time on the phone and this. This is called as contact overload. Idea is people, too much of people, or maybe a single people, or I don't know how to deal with them. So this is one more type. So these are 4 types. Situational, encounter, time and anticipation. Approaches. Make it simple. Now how do you approach stress? 3 approaches. If the situation is solvable, action oriented. Simple. Very often we make a mountain out of a molehill. Most often. So the most important strategy in treating or working on this management of stress is emotional oriented. So most of the time what we really need is a emotional oriented, which is changing yourself. And there are certain things you can't change. You just cannot change. So there you have to learn how to be calm, how to be centered, how to be meditative. So here you don't do anything, neither change yourself. You change yourself, but in a very general way, you use to reduce the tuning within you. But it is not specific to something. So action oriented is very easy. Take action to change the stressful situation. So you have an action plan. It's pretty much common sense, managing time. So first you have to identify where you have to improve, what you need to change, why you are managing your time not well. Probably make a to-do list. Okay, this I'm going to do this. Set your priorities. People. So here you will have to do many things. Now what is the problem behind? We'll have to study. Maybe I'm not assertive enough. She tells me do this, I'll agree. You will tell me. I don't know where to put my boundaries. I don't know where to say no. So these are specific things which we'll have to work on, like assertive training, setting up boundaries. And I have a problem of not saying no to anybody, because what will you think about me? Maybe you will not like me tomorrow. You know, there are, don't say yes when you have to say no, and there might be many books on this point also. It comes from low self-esteem also, because you want to be good to everybody so that people like you. So you have to be able to say no, this I can't do. So very, very important is to say yes to the person but no to the task. Be good to the guy, but you say no, but I can't do this. So again, though we are dealing with the situation, we are actually dealing with ourselves. Everything finally boils to changing us. We have to learn to be assertive. It's not that easy. People who have problem with this know how much they are struggling with it. It's not that easy. Okay, from tomorrow I'm going to be assertive. It's not that easy said than done. Setting boundaries. People are struggling. This could be their life issue. They just don't know how to make borders. Everything comes in. And then they can even become irritable and scream, shout, even break and throw things because they don't know what to do. Where to set boundaries, how much I will take, they don't know. So other way of looking at it is also the ABC technique they say nowadays. A is adversities. So we talked about stress is because of adversities. But whenever there is an adversity, what happens is our belief systems come in. And those belief system decides C, which is the consequences. It's not that because of the adversity there is some consequences. In between there is a belief system. For example, I have to do some presentation in a meeting, and last minute my assistant forgets to print the report. The first is, what a useless boss I am. Now this is your belief system, it has awakened. And then what happens is, your meeting, you sabotage it. So this belief system is what we have to address. This we all know about SWOT analysis. So we have to know a little bit about what is our strengths, our weaknesses, what opportunities we have, and what are the possible threats to it. I think this is whoever company, people are working in these companies, they know about this. They go through this SWOT analysis. Strength, weaknesses, opportunities and threats. So this is called unprejudiced, unbiased observation. Something like what we would call, in this nowadays what we talk as Sakshi Bhav. Just observe. See what is happening inside you. And next is rational thinking. Challenge these negative and ask whether they are thoughts. Sometimes they say delusion is disease, awareness is cure. Delusion means till I have this irrational belief system, I have disease. But the day I become aware, already it loses its push. So just being aware that I am governed by the negative will remove the force, the fuel from it. It takes away the punch. So awareness is very important. Rational thinking naturally comes. Using affirmations. This is what very often you hear this. If you go to a psychiatrist or a therapist, they would tell you. They are positive statements. Keep telling yourself, I can do it, I can do it, no, I am good. These are called positive affirmations. Positive statements, specific statements. Not I am good, things will happen, but very specific. I am able to talk in a meeting. I'm able to do a certain job. So you have to visualize you doing that, believe in yourself. So these are like your exercises of your mind and of your outlook. So these have to be repetitive. You can't do once, but many times you will be telling. What are you doing by telling yourself many times? Awareness. Different packages of awareness. If you keep telling yourself, very often by telling yourself, you don't go in automatic mode. This is the underlying statement. But for short-term negative thinking, some stress comes. You don't know what to do, so that time you can use imagery. Creative visualization. So in a difficult situation, they help you. What they do is, let's say I've got a stress. Now I'm getting stressed, and that stress is affecting my health, also my effectivity, also my relationship. So what I can do is imagine, close your eyes, connect to that in as much detail as possible. Find a quiet place, choose what you want to think. We all have had some moment where we were very peaceful. Maybe you were sitting with your guru, maybe you were somewhere in the Himalaya. Make it as real as you can. And when you make it as real, you make even that state which you experience then reality in your life. You are sort of transformed and you move into that stage, in that zone, when you were completely relaxed and peaceful. So use this as your, thing in a pocket. You know this thing, just sit quiet, get into a place, sit and just go there, and you will see how you diffuse yourself. And take your time as much as you can to relax there. This is very, very effective. Just shut off. Last is acceptance oriented. What you cannot change, you have to endure. So these are, you build your defenses against stress. So you are becoming more stress proof. This is not towards any specific thing, but you are working in a direction to become more stress. This is your overall sense of well-being. It is not only with your boss, it's not with something. This is in general how you are going to deal. If you have good exercise, if you sleep well, we'll talk about stability zones, meditation, mindfulness, centering. Exercise. We can go very quickly. I think who doesn't know about this? So when you exercise, you release endorphins. And these endorphins are, endorphins is something like opium. It's very cooling, very relaxing. You don't feel anxious. In fact, I remember as when I was a student and I was studying in 70s in psychiatry, we had done this. There were people with mild depression. We just told them, we'll not give you any drugs, just do mild exercises. And most of them didn't need any medication. It's antidepressant. You even improve your learning. Sometimes we tell children, no, don't go to play, sit and study. But it increases brain growth, improves learning capabilities, it improves mental performance, it releases growth hormones. So it's like you're taking away the most important thing from the child. If he plays, he studies well. More energy, and it lasts long. Because there is more oxygen going to your brain, more nutrients are moving in your body. Increases your confidence. You sleep better, your immunity improves, you don't fall so sick. Just some statistics, 35% lower risk of coronary heart disease, 50% lower risk for diabetes. You all know heart and diabetes, whoever be the doctor is going to tell you, start walking. Risks: 50% risk less of colon cancer, 20% risk less of breast cancer, 30% lower risk of early death, 30% risk less of dementia. I think this is another problem. Also, because of stress, you have this problem, but certain techniques, simple things. If you exercise regularly, other thing is we need to go out in sunlight. So don't take caffeine, alcohol in the evening, or take it moderately. And relax. Don't pick up arguments. If you want to just scold your son or your daughter, do it in the morning. Don't do it at night after you come. Because you're all worked up. You're not studying, you're not doing this and all this, and why is the house in this way, and whatever you want to do, and then finally you can't sleep. And fix time for sleep. You must have fixed time. Stick to a familiar routine, create a right atmosphere, environment. Stability zones, very important. So what are these? These are personal stability zones. We all need something. These are the places or things that make you feel safe, relaxed and secure. And they are buffers against the outer world. We are all facing the outer world. We need to go into our cocoon zones where we feel very safe and secure. What is safe? Something which we are familiar with, that which doesn't change, like parents' love for us. It never changes. So when you are in your stability zone, and if you create such stability zones, they can be very, very helpful. Like people who have similar values, you meet your friends, maybe it's your spouse, though rarely, then parents, co-workers. So it could be anybody, they are your stability zones. You go there, you know that, you meet your friend and you are relaxed. This helps you chill. So we are living in such fast moving world. Really fast. Things are becoming narrower now. World is becoming smaller. So we need something which does not change. It's like brakes. In fast moving things, something which is very steady, solid, grounded. And then meditation. So it's not just a new age practice, people have done it for thousands of years. Relaxation techniques. Should I tell you, it is very good for your health and well-being. It slows your breathing. You become more focused into the here and now. You can do meditation, tai chi, yoga. Sometimes you don't have to do relaxation, they say. It can be very active also. Some people cannot sit, but they can go into the outdoors, in nature, sports. It doesn't matter which is the relaxation technique, but do it regularly. The mantra is in the regularity of the practice. Mindfulness. Just play with words. It's same as awareness. To be mindful. I like this picture very much. When you're walking on those pebbles which are shaky, how alert you are. And also see the ripples. The ripples around tell every action of yours has so much of consequences in the world. We use words, our deeds, our actions, our thoughts. We think they are nothing because we feel we are nothing. And how much it has effects and repercussions. So this mindfulness is being aware every moment. It is to live a meditative life. Everything in one's life is there as a vehicle for one's transformation. So it's how you see it. Is it an adversity or is it an opportunity? So now what I'm trying to tell you is, give meaning to our life. If we are born to believe that there is a purpose behind me being born, and that I am a part of some grand design, so broaden our outlook. In a way, what I'm trying to say is, one is a narrow way of looking at things, other is to zoom out and see the big picture in life. We are all transforming through experiences. If there would be no adversities, there would be no growth. We are all in the same school, we are all in the same planet, but we are mastering different things. And that makes us different. And you're born with certain weakness. We talked about SWOT analysis, strengths and weaknesses. But wherever is your weakness is where your lessons are. So instead of being approached as a problem which has come, you have to make it a lesson approach, that I have an opportunity to overcome myself. This makes completely way of looking at it completely different. Our lives have a specific significance and purpose, and we have to discover our unique and special purpose. So find meaning into your life. What am I here for? And aligning our life to this purpose makes it meaningful. So what are the qualities you have to develop? PERMA, PERMA. This has to become permanent in your life. 5 essential elements needed to experience lasting well-being. Like these 5 petals. One is positive emotions. Second is engagement. I think we all have to find something which we have passion for, love for. Effortless. So find out something which you can get completely engrossed. You should get lost. Learn to lose yourself. This is that ego we were talking. Lose yourself into something. Key word for me, self-esteem. This has to be earned. It cannot be demanded. Self-esteem is very, very, very. Learn to be happy being in your own skin. This is very important, and this has to be earned. You have to rise in your own eyes. Feel proud about yourself. Feel good about yourself. And that again comes from what you do, how you live your life, find meaning, sense of fulfillment. Think of long term, not immediate gratification. Self-esteem is the key word. Finally, it doesn't matter whether your wife sees you, your children sees you, your neighbor sees you, your boss sees you. You are seeing yourself all the time. And then you build walls around you. You become more and more disconnected from yourself because you cannot see yourself. You make walls and then you are cut off. Then one complete journey is blocked, which is the most essential. So where does homeopathy come in? Let's talk about homeopathy a little bit. So what is the concept of homeopathy? I was educated in modern medicine, but I switched into this. Two fundamental themes of it is holism and individualism. So we don't believe that that a part is sick. We don't say that my nose is sick, or my kidney is sick, or my lungs are sick. Person is sick. And also each individual has different. I am prone to sinusitis, somebody is prone to headache, somebody is prone to acidity. Constitutional. We are all individual. So all what I have talked, now I am packaging it in homeopathy. Individual. We are all individuals. So homeopathy, why I am telling you all this is, it directly acts on these inner disturbances. It's like there are ripples, and when you give something, every disturbance has a pattern. And if you know which substance in this world can take care of this pattern, and when you give it in potentized form, like yours like, As I told you, stress is not because of external factors. We are not affected by stress in the same way. So I talk to you about self-help books, I talk to you about counseling, I talk to you about cognitive behavior therapy. Most of them tell you that you have stress, okay, I'll tell you how to learn to live with it. So they teach you to cope with stress but does not make you really stress free because your inside has still remained the same. Unless you change from within, those things help you.